have type 2 diabetes, or really any diabetes, but I do focus on type 2, and you're wanting to get pregnant, then it's never too early to start planning. And this is because there is a lot to consider when you have blood sugar issues and you are planning a pregnancy. So it's really important to start as early as possible. If you are not well controlled, or you're not taking care of your diabetes or your own health before you get pregnant, this can actually lead to a number of complications for yourself and for your baby. So it can increase the birth weight, birth size of your baby. It can lead to increased risk of complications and things like preeclampsia or even birth defects for the baby. So I don't think I need to say much more than that to convince you that it's important that you take care of your own health before you start getting pregnant. And you might think, well, I'll just get on top of it when I know that I'm pregnant. That will be my big motivating factor. But the first 8 weeks of your baby's, after conception, when your baby is starting to develop, that is a major time for all the organs in your baby's body to develop and start to, that's when their health starts. So making sure that your health is optimal before you conceive is really, really important. So depending on who you talk to, they'll probably say you want to make sure that your health is optimized about 3 to 6 months before you start trying for a baby. And it normally takes us about 12 months to make sure that your nutrition is optimal. So when I say you really can't start too early, I really mean it, because it's not just for your baby, but also for yourself, because of course you're going to be getting the health benefits from this as well. So don't stop your contraception until you are in that optimal place. And the reason I say that is people often think, well, I'm going to struggle to get pregnant, so I might as well just start trying now because it'll probably take me another 3 to 6 months to get pregnant. That's not true. You could fall pregnant tomorrow. So please don't stop taking your contraception until you feel ready to actually get pregnant. So one of the biggest things when we talk about planning for a pregnancy with diabetes is your blood sugar level. And I'm sure that your doctor has previously talked to you about blood sugar levels and making sure that your blood sugar level is ideal before you get pregnant. But what does that really mean? So in pregnancy, for a lot of people, this is their target in general, but in pregnancy in particular, we want your HbA1c to be 6.5 or below. So that is the blood test that you get from your GP, and you get it about every 3 months, and it gives you that broad picture. So you want to make sure that your blood sugar levels are looking pretty good, to be honest, before you start getting pregnant. And so obviously to do this, you need to be testing your blood sugar level. So it's a really good time to make sure that your blood glucose monitor, your finger pricker, is well maintained. You can get it serviced or get a new one if it's very old. I used to hear that the companies would actually replace it after a certain amount of time, so you might want to do that. Personally, I really like the Freestyle Libre blood glucose monitor, which is the continuous or flash glucose monitoring system that gives you the blood sugar levels once every minute, because that really gives us so much data about what's going on in your blood sugar levels rather than just a snapshot that the finger prick does. So that's my preference, but obviously it's a little bit more costly and it really depends on personal circumstances. The other thing from a nutrition perspective is you want to make sure, obviously, that you're getting enough nutrients. When we have diabetes, we really want to think about folate, and you've probably heard about folate previously. It's really important in spinal cord development, and it's recommended for all women who are trying to get pregnant. But with diabetes, we actually need much higher levels of folate. And so you need 5 milligrams per day. So just having a standard folate formulation is not going to cut it. So make sure that you get that 5 milligrams a day in your supplement. You also want to make sure that your medication is going to be suitable for when you are pregnant. So not all medications are suitable for pregnancy. Metformin is, although you're very likely to move to insulin after second trimester, but you want to make sure before you get pregnant that any medication you have is going to be okay for the baby and isn't going to harm the baby. And then while you are getting that checked with your GP, you might as well also get checked any potential diabetes complications, because these can sort of also rear their ugly head when you're pregnant. So knowing about them earlier is obviously better. So make sure you get your renal function tested, go to the optician, go to the dentist, all that sort of thing, and make sure you're on top of everything. So that's quite a few things for you to be doing. So just to recap, blood sugar should be a HbA1c of, 6.5. Get your glucometer checked, or be, taking your blood sugar on a regular basis. Folate, check your meds, and check for any diabetes complications. All right, and if you need help planning your pregnancy, going into your pregnancy and making sure that your health is optimal, of course, that is what we are here for as a diabetes educator and dietitian who specializes in fertility for people with type 2 diabetes. That is what I live and breathe. So if you need me, you know how to contact us. And until next time, see you later.